This case is an example of the serious side effects of combined oral contraceptive. A 28-year-old woman attends a family planning clinic requesting counseling about the risks associated with long-term combined oral contraceptive pills, OCP use. She is otherwise healthy and non-smoker and has no significant past medical history. Which of the following is a rare but serious adverse effects associated with combined oral contraceptive pill use? Is it breast tenderness, weight gain, mood changes, ovarian cyst formation, hepatic adenoma? Hepatic adenoma. The correct answer is hepatic adenoma. Why? Hepatic adenoma is a rare but serious complication of prolonged estrogen exposure. So the hepatic adenoma is a serious complication of prolonged estrogen exposure. So the estrogen component of the combined oral contraceptive pill is a serious component with serious side effects as hepatic adenoma. These benign liver tumors carry risks of hemorrhage and malignant transformation, particularly with long-term use. Okay, so why hepatic adenoma is a serious complication? Because hepatic adenoma carry risks of hemorrhage and malignant transformation. Hepatic adenoma has a high risk of hemorrhage. This hemorrhage will lead to severe abdominal pain, okay, and malignant transformation. Why the other options are incorrect? Breast tenderness is common and benign side effect. Weight gain, often perceived but not strongly evidence-based. Mood changes, common but not life-threatening. Ovarian cysts actually reduce cyst formation. So ovarian cyst is not a complication as combined oral contraceptive pills reduce the cyst formation. Okay. So let's talk about hepatic adenoma and why hepatic adenoma is a serious complication. So this is a CT scan of a 41-year-old female with no complaint. So it can be incidental finding, okay? So this patient without complaint. So here, CT scan of the abdomen with intravenous contrast from a dynamic study show a delayed phase. This is the delayed phase, okay? Demonstrate an encapsulated, okay? So the characteristic finding of hepatic adenoma is encapsulated mass, encapsulated hepatic mass, encapsulated heterogeneously appearing lesion in the right lobe of the liver. Encapsulated heterogeneous lesion in the right lobe of the liver. This is the appearance of the hepatic adenoma on CT scan. Liver lesion with a capsule is a key finding of hepatic adenoma. HCC, the other differential diagnosis, is HCC metastasis, and the diagnosis here is hepatic adenoma. Hepatic adenoma is a hepatic lesion with a capsule in a patient at risk for HCC. Okay, so hepatic adenoma has a high risk for development of HCC. Remember, pseudocapsule enhancement is only seen during the arterial phase. Okay. Consider hepatic adenoma with an encapsulated hepatic lesion in a young female on contraceptive pill. So this is very important. We need to consider hepatic adenoma with whenever you see an encapsulated hepatic lesion in a young female on oral contraceptive pills. This is another case of hepatic adenoma. A 42-year-old asymptomatic woman evaluated with MRI for incidentally detected liver lesion. Again, hepatic adenoma is an incidentally detected liver lesion. So this patient had MRI for incidentally detected liver lesion, and she's asymptomatic. So the findings here: T1 weighted enhanced image. This is the T1 weighted. This is a T1 weighted contrast enhanced image, gadolinium enhanced T1 weighted image, showing a well circumscribed, homogeneously, avidly enhancing mass. Well circumscribed, homogeneously, avidly enhancing mass in the right lobe of the liver of a non-cirrhotic liver. Okay, so the underlying liver is not cirrhotic. Okay, if the underlying liver is cirrhotic, so this lesion is more likely to be HCC, hepatocellular carcinoma. Okay, so we have here a homogeneously well circumscribed enhanced lesion, avidly enhancing lesion. So the most important MRI findings of hepatocellular adenoma is that the hepatocellular adenoma avidly enhancing on the arterial phase. Also, the hepatocellular adenoma contains microscopic fat. This is very important criteria of hepatocellular adenoma. Avidly enhancing on the arterial phase and contains microscopic fat. So there is a sequence to detect the microscopic fat content of any lesion. It's called T1 in phase and T1 out of phase. So the lesion on the T1 in phase will be of slightly high signal, and in the out of phase image there will be a drop of signal of the lesion, as you can see here, opposed out of phase or opposed phase. Okay, opposed phase T1 weighted image shows loss of signal within the mass compared to the T1 weighted in phase image. Loss of signal within the mass indicating microscopic fat within the lesion. So the focal nodular hyperplasia doesn't contain any lipid or hemorrhage. Okay, doesn't contain any fat component, any microscopic fat component. Okay. Hepatocellular adenoma is uncommon It's rare, as I mentioned. Benign hepatocellular neoplasm that most often occurs in young middle-aged women with a history of oral contraceptive use. These lesions are typically solitary. It's not unusual to see 2 or 3 in one patient. Multiple lesions can be seen in patients with glycogen storage disease. Okay. Most patients with solitary adenoma are asymptomatic. As I mentioned, hepatocellular adenoma is usually asymptomatic. However, large adenomas might cause right upper abdominal fullness or discomfort. Okay, so the adenoma, if it is large, it may cause symptoms like right upper abdominal discomfort. It will be symptomatic if it is large adenoma. Adenomas are sharply marginated, non-lobulated, and may have a capsule. Okay, so having a capsule is a common criteria of hepatocellular adenoma. On MRI, most adenomas are hyper-intense on the T1 due to increased fat content, increased fat and glycogen. While lipid is present in an adenoma, there is signal drop out on the opposed phase T1 weighted image. On T2, adenomas are predominantly hyperintense relative to the liver. Most adenomas are heterogeneous on T1 and T2 due to hemorrhage and necrosis. On gadolinium enhanced sequences, hepatic adenoma have an early arterial enhancement. So on gadolinium enhanced images, hepatic adenoma have early arterial enhancement. Management of hepatocellular adenoma. Hepatocellular adenoma have a risk of hemorrhage. That's why it's a serious lesion. Hemorrhage or malignant transformation, exactly as we mentioned. Hepatocellular adenoma have a risk of hemorrhage and malignant transformation. Treatment strategies may vary from hormone therapy, cessation, so the patient needs to stop the oral contraceptive pills, serial imaging, to resection and embolization. Resection and embolization. And before that, the patient needs to stop the hormone therapy. Hormone therapy, oral contraceptive pills, cessation, then resection and resection and embolization of the lesion.